Hello, everyone. It's another day with your fertility specialist. I'm your host for today's session, Ruth Ogogo. And on behalf of Alps Hospitals, we'd love to say thank you to our dear viewers. Thank you for liking our post. Thank you for sharing. Thank you for always staying glued to your screen. It's a Friday, it's weekend.
So we like now.
Can you hear me? Everyone, it's another day with your fertility specialist. On behalf of Alps Hospitals, I welcome you to another session of the day with your fertility specialist. For today's session, I'm your host, Ruth Ogogo, and I'm excited to be with you. It's good to have you, our dear viewers. As we get started, please call up someone, share this link with someone. If you need to send data to someone, please do that right away. Drop your thoughts, your questions in the comment section, and we'll definitely attend to them. They were talking about what happens in the IVF laboratory. So, yeah, to talk about this, we have Mr. Steven. Steven, it's good to have you with us today.
Thank you. It's a pleasure to be here once again.
So, I know that of times people say I'm coming for IVF, and you just what really happens in that inner cortex they call the IVF lab. So, we're here to talk about it. And yes, we have with us, like I mentioned earlier on, a bit about him. He's an embryologist, senior embryologist at, as a matter of fact, and he's also the head of the embryology unit at Alps Hospital. So it's good to have you with us, Mr. Stephen.
Thank you once again.
So, viewers, we're talking about what happens in the IVF laboratory. Those things that happen, those secret things that we don't seem to understand, those microscopic things that we don't seem to understand. We're talking about it today. So, well, in a nutshell, should I say in a nutshell now, or in whichever language you want to explain that we understand? Because I know there are lots of terminologies that we might not understand, but in the simplest way we can understand what really happens in the IVF laboratory. Speaking of, you know, talking about the eggs and the sperm, what really happens with them in the IVF lab?
So the IVF lab is like our shrine, as some people
Oh
call
yeah.
it, secluded area,
Mm-hmm.
highly sterile.
Mm.
That's why you go in there very clean. Everything is sterile, including the air that we work with here. There,
Oh wow.
the air filters that continuously filter the air. Your incubator is working fine. So it's where the magic happens.
Mm.
For every biologist, we are your first babysitters. So
That's
that's
right.
where
I
the
like
magic
that.
happens as an embryologist, where egg collection is done,
Mm-hmm.
andrology, where the semen is being analyzed,
Yeah.
where treatment is done, depending on the type of treatment,
Yeah.
where the oocyte quality is being assessed also, the sperm quality is assessed,
Mm-hmm.
the embryo, resulting embryo, you check for fertilization also, check whether
Yeah.
there's fertilization or no fertilization.
Mm-hmm.
The resulting embryos, you grade them and see the quality of the embryos you have. So
Yeah.
all these things happen in the lab. If you're freezing, for example, excess, that's vitrification, cryopreservation. That's where all this magic happens. But
Mhm.
at different conditions, that's when we do all these things in the IVF lab.
Okay, so I'm just curious. So usually, like when scans are done, you hear clients saying, "How many eggs are you seeing?" And from the scan they're asking, "How many eggs are you seeing? Are you seeing eggs?" And then they'll be explained to that, okay, we're not seeing the eggs, is when they are retrieved and all that. So how does it really work? Like, how do you get to see this egg and sperm that we don't seem to understand, or what we seem to interpret in another way? How do you put in your shrine?
So
Oh
we
yeah.
have we have high-powered microscope,
Oh.
inverted, different equipment that helps us do this. We don't see them with the ordinary eye.
Oh, I see.
So one of the first things that happen is semen analysis.
Hmm.
The semen is checked, is analyzed, the sperm is being prepared. You don't use the sperm the way it's being brought.
Oh, I
Of course,
see.
semen
Okay.
includes a whole lot of things. So,
Oh.
but getting the sperm cells now, that's what we do there. And seeing the sperm cells for what they are.
Mm.
Now, the quality of your semen determines the kind of treatment you have. So that's like the first stage. You analyze your semen. Then there's what we call the oocyte pickup, or OCR, oocyte recovery, as some people say it.
Okay.
That's where we get these eggs, like you asked. Now, the eggs, when you see a scan, appears as follicles, so they're surrounded by fluid. So is this
Mm.
fluid that's been,
Oh, I
yeah, so
see.
is this fluid that we call follicular fluid.
Oh,
So the
okay.
follicular fluid is aspirated and given to the embryologist. So it's
Mm.
this follicular fluid that you analyze and then you check for oocyte. That's
Yeah.
the eggs. That's what you
Yeah.
check. So you pick the
Okay.
eggs
Mm-hmm.
from each fluid, you clean, you wash, you analyze, then you
Wow.
culture.
Hmm.
And in some cases, you even strip this oocyte.
Wow.
By stripping, I mean removing the cumulus, but I'll explain
Oh.
much better when we get to the other forms of treatment.
Wow. So this is now it's making us understand that, yeah. So now he has even explained about the fluid. So it makes you know that when they say they are doing egg collection, they will not just catch egg with shell and give it to them.
Of course,
It's
yeah.
more like aspirated. It's contained in a fluid, and like he has let us know, you don't see it with your eyes, and that's why they are more like our eyes. The doctors will retrieve the eggs and then give it to them. So now it's more like saying, should I say this is a scenario where a blind person has brought the food, then you now help the person to put it into their mouth, because it's now more like, okay, they don't even know the food per se. And then somebody now guides the food into
Food.
their mouth, because they are now the ones that see the food. Someone that is seeing well, that's more like the embryologists. Now they are the ones that now see and tell us, these are the number of eggs we have.
Yeah.
Maybe we've been seeing 20 follicles, and then they're now telling us 5 eggs, and we're like, "Ooh, really?"
Yeah.
After this hard work of retrieval and all that. So hope that makes a lot of sense to us. Well, this is us just thinking, what are the major roles? Because embryology seems to be like a big word to us. What are the major roles of you embryologists in the IVF lab? I mean, IVF lab embryology. We just want to understand better.
So in short terms, embryologists are expert in oocyte, egg, and sperm.
Mm-hmm.
And then we are responsible for fertilization of these gametes, preserving them. But more importantly, what you use to do all this work also, we're in charge of the stocks and everything, getting everything ready.
Oh.
Now, the lab is like I use the word, like our shrine, has to be in optimal condition.
Oh,
You're looking
okay.
at your humidity, you're looking at the air there. That's why there are a lot of rules for somebody coming into the embryology lab,
Mm.
because at that level, you don't leave everything to chance. And that's why
Mm.
the perfume, the roll on, and all these things, we don't allow them there
Yeah, I
because of
see.
how sanctified the sanctuary
Yeah.
has to be.
Oh.
So the maintaining of this optimal condition, because when you have this optimal condition in place, that's when can guarantee you a good result. A good result, yes. So maintaining the incubators, calibration of all this equipment, maintaining the sterile environment, quality of air there,
Mm.
making sure your VOCs, volatile organic compounds, are barest to the minimum as much as possible, and making sure everybody working there is doing the right thing.
Mm.
So when you come into that place, you see it's like a shrine. That's why I'm saying people come in, they are shocked. That's why you see we operate at certain temperatures. depending on what we're doing, whether it's egg retrieval or vitrification, because all these things you're doing, you're looking at temperature and you're just trying to mimic what goes on in the human body. We're
Body.
not
Oh,
doing
I see.
anything, we're not creating babies, as some people will say. We're just looking, mimicking what goes on in the human body for those that have challenging achieving spontaneous pregnancy. So the role of an embryologist is vast. It depends on how much the center does and how big that center does. So the role can be
Oh
as
yes.
great as you can imagine.
Permits me to be worried a bit. So I was just thinking, fertilization usually happens in a woman's fallopian
Yeah.
tube. So I'm thinking, do you have like an artificial fallopian tube in the IVF
So,
theater?
fertilization appears in the fallopian tube. There are some mucus, some fluids. It's
Mm,
not just a dry surface. So
okay,
all
I
these
see.
things have been produced as IVF media.
Oh, I see.
So different media are required for different stages of
Mm,
treatment. When
mm.
you want to culture an egg, there's a media for that,
Oh, I see.
mimicking the fluid that are present at that place, the
Mm,
ammonium, amino acids, the protein, the glucose, all the processes, the biochemical processes that are caused in a woman.
yeah.
All those things are being studied and they are being brought into real life so that you can copy what is happening. That's the
Oh, I
word
see.
at that
Okay.
stage. So we do our fertilization in a dish, not
Okay.
inside a fallopian tube.
Okay, I
So
see.
fertilization happens in a dish with your
Oh,
incubator. So
okay.
all these media, they are being prepared, they are being equilibrated to certain temperatures. So just what is happening, you do all this, then we do the fertilization either in the ICSI dish or in your conventional dish, then store in the incubator that maintains the temperature for the
Yeah.
human body, so
Mhm.
that there will be further development and assessment of these gametes
Okay.
after a particular period of time.
Okay, so I know that you could do some gradings with embryos. You look at the before you grade, and then you see that if embryos don't even get to a particular grade, you just feel like you discard them, or you feel like no, it's not good for the woman to get
So
that.
a lot of things happen before the embryo gradings. So treatment is done. We pick the oocyte
Mm,
depending on the quality of the sperms you
yeah.
do, whether or the type of treatment you do. What we call the conventional IVF, which
Oh.
is you're inseminating, you're putting the eggs and the sperm in a dish, you put them together, fertilization happen. Or the ICSI, intracytoplasmic sperm injection. This is where it's like you strip the oocyte of its clothes, you are removing it, there's no clothes, so you can really see what the oocyte is. And
Yeah.
the oocyte has to be matured before
Mm.
you do that particular one. Then you pick a single sperm using your ICSI machine,
Oh, okay.
where there's your injecting arm, your holding arm. So immobilize the sperm, plenty technical stuff.
Yeah.
Then you do the fertilization. Then after some period of time, between 16 to 18 hours, you come to check for fertilization.
Mm.
So after fertilization, you do what we call cleavage check.
Oh,
So cleavage check is where you assess how these embryos are developing, whether they
okay.
are developing properly. Because for every day, there's a stage in which you expect these embryos to
To
be.
get to.
So
Okay.
usually in the practice, you can do your what you call embryo transfer on day 3 or day 5.
Oh, okay.
So at day 3, you expect the embryos to be 8 cell,
Okay.
eight cell stage. So when you're looking at this, you're looking at a lot of the blastomere, how it's looking, how the thing formed, and all those things.
Mm-hmm.
No fragmentation. So that's how you analyze these embryos in
Oh,
terms of
okay.
quality. Then if it's getting to day 5, that is the blastocyst. Of course, that's the last stage of embryo development.
Okay.
So some embryos get there on early on day 5, some much later day 6,
They
some
get
get
to.
there. So the major this thing is having the knowledge of where the embryo is to be, comparing the development to that day, and as well carrying the patient along to know how our embryos are doing.
Doing. Mm.
We carry her along, we give all this information, then she tells us what
What she
we should
wants.
do. Because
Okay.
already the consent is there to guide that this is how this process is. Then we'll come tell you, okay, madam, at this stage, this is the number of embryos you have, this is their qualities. What do you want us to do going forward from here? Do you want to
Mm.
freeze all the gametes, all your embryos? Do you want to have some transfer, freeze some, or do you want to have everything?
Mm.
So she makes her decision, then we guide her on what
appropriately.
to do, yes, appropriately. Yeah.
Oh, viewers, a lot said about this, and that's why you trust your fertility team to give you the best of information. And it's also not weird, like he had mentioned to us, how this development happens. Sometimes, yes, I was just going to ask, are there things that are responsible for how the development happens? Are there things that you foresee that will make you
Yes,
preempt how an embryo will be?
yes. Once your lab is in optimal position, you've taken those factors out. So the quality of gamete,
Oh, I see.
yes. If the air quality is not great, of course, the development won't be great. If the air
Oh,
quality is great, sperm great, you expect a very great embryo at the end.
mm,
So, but if one of the quality is not too great, a lot of factors can come in,
come
looking
into
at the
play.
quality of this oocyte or quality of the sperm. So that also translates into the quality of embryos that will be generated at the end.
So are there times that you have like from your assessment, you feel the eggs are okay, the sperms are okay, and the embryo development doesn't match what you feel like you treated?
Yeah, sometimes on rare occasions, sometimes you can have that situation where the oocyte looks good, the embryos appear, sperm too looks good, and then the quality of embryo you're getting is
Obviously.
not matching. But most times when that happens, the age of the patient comes into play,
Play,
and the
okay.
form of treatment the patient is doing.
Oh, okay.
For those that advance in age, of course, the way the quality of a younger person and the quality of embryos is not the same as those that are advanced in age,
Hmm.
because I don't want to go into the the biochemistry that's
Yeah.
involved in all these things. But you have that because of the old age, the mitochondria that is present in driving the generation of ATPs. That's the power in which
Okay.
these oocyte or embryos will be using. All these play a role. So age factor usually in that it can appear good, sperm good, but when you look at the age, probably she's a bit advanced in age. But for the younger ones, on rare occasion, except of course sometimes something is wrong, but most times when you see this, you have to go troubleshoot, look at the quality of the sperm
Mm.
properly now, because you know what, you're just looking at what you can see. Then you can
Yes.
do the advanced analysis on some
Oh,
of these sperms, yes,
okay.
to
Mm.
check whether the oxidative stress present in the
Okay.
sperms.
Okay.
That's when the DNA fragmentation, the integrity of the sperms
Oh, I see.
also play a
Okay.
role. So
Mm.
yes, but most times when gametes are okay and the quality is good, the
Mm-hmm.
resulting embryo is usually good. Though it may not also translate to pregnancy,
Pregnancy. Mm.
because there's another whole world of factors that guarantees pregnancy. You have the best embryo, where are you putting it? Just like
Mm.
having a very
Yes.
good seed and you're
Mm-hmm.
planting it, where are you planting the seed?
Mm.
What's the state of the soil and all those things? So those are another wild place that play a role in achieving IVF
So,
success.
so embryos can look very great and pregnancy still doesn't happen.
Yes,
It's possible.
it's
So,
possible. Yeah,
and that's why IVF is not guaranteed anywhere in the
yeah,
world. Everything can look great and IVF still fails. And
feels
that's why they said the success of IVF is increased with repeated trials. And that's the more you try, the more your chances
chances
of
of achieving
succeeding.
success.
Yeah. So, when for some people that have encountered failure and they are not exactly able to pinpoint and say, okay, this is the exact reason why it must have failed. It's just to tell you that everything can look perfect and
And
it
it still
still
feels,
fails. Yes. But I'm sure that your fertility specialist, they might just try to look and see what can
yeah,
be done
troubleshoot,
differently.
yeah.
Not like something was done wrongly,
Of
but
course, yeah.
yeah, it's just a way of saying, okay, let's try it another way and see.
Of
Maybe,
course, yeah.
just maybe, there might just be a change. Okay, so what happens to embryos that are not eventually transferred? Because I know you mentioned, what
So
do you eventually do with embryos?
So the patient still decides.
Oh, I see.
Yes, the patient still decides.
Okay.
We'll tell you, madam, you have 5 embryos. Of course, from desperation and waiting over some time, sometimes, give me everything. We said, no, 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 we can't
Mm,
give you everything. We can only give you maximum this particular number. Then we'll look at her age, if there any presence of disease condition, because it's not just achieving pregnancy. You want the
yeah.
woman to be here to hold a bundle of joy.
Yes,
So you
that's
hear
true.
of maternal death and all those
Mm,
things. No,
it's
it's not just getting pregnant and you're not there to witness the joy.
true.
So
True.
we guide and tell her, okay, you have 5 embryos. Let's do two.
Mm,
These three we can freeze.
mm,
If this does not work, you can come back and get it. And if it works, of course, you still
It's still
store.
there.
Later in the future, you come
You
get your
come
remaining
exactly.
embryos. So the patient gives us that option. Some will tell you, okay, they don't, just give me three, discard the remaining two. So of course, there's consent for that. You sign, and
Oh,
then
I
whatever,
see.
yes, whatever you tell us to do, that's what you do. But for most times, for those that have excess embryos and they are financially capable, they tell you to store the excess
And
embryos, and when
freeze.
they're ready, they come
Come
back
back
for
for
it.
it.
And sometimes the embryos may be five, but their qualities are not the same across bird. So it may
Mm.
be because vitrification is another whole world again,
Mm.
because the quality has to be great for you to survive that process.
Of
You are
freezing.
putting human tissues, storing them in minus 196 degrees,
Wow.
using cryoprotectant and other things.
Yeah.
So if the quality is not great, it may not survive that
Oh,
process of freezing and
freezing.
thawing. So based on the quality, we advise them, this is what you have, we can do this, we can do this. But ultimately the patient decides. We are just there to guide.
Hmm. So, viewers, at any point in time, if you're actually counseled to freeze embryo, it means that they've seen the prospect of the embryos possibly surviving freezing. And I think it's something that anybody going through IVF should actually think of
Yeah,
if you
absolutely.
have excess embryos. Because you never know, as much as
Yeah,
we are hopeful and optimistic that it could succeed, it just might
may not
not.
succeed. Yeah.
So you have to look at it. What if it doesn't succeed? I mean, it's yeah, it's risk involved. And sometimes some people be like, yeah, I'm hopeful it will succeed, but what if it doesn't succeed? Instead of going through the whole rigorous process of trying to stimulate yourself, that's if you're using your own eggs and all. I mean, you could still freeze the embryos and possibly have a shorter duration of treatment or a less rigorous treatment than if you were to start afresh.
Fresh, yeah.
And even for those that feel like, okay, there isn't donor, once they've mentioned to you that you have excess embryos,
Of
for
course.
instance,
Yeah.
because they are, most times for donors, sometimes you might not have excess embryo, but if you have excess embryo and they've counseled you, I think from now people should have an open mind, should get B because he has mentioned it's in a consent. You go through the consent. When you think you want the embryos to be frozen, of course they'll talk with you,
Yeah.
let you know what is involved. And if you're open to it, it's a good idea to freeze to save yourself. Eventually, when you're coming to pick up these embryos, it's less expensive
Yes,
than
less
when you
expensive.
want to try another IVF afresh. So, but just that at that moment, you're just thinking of it to succeed, and then I won't have to. Some will say, don't worry, three will stay or
Three will
two will
stay. Yeah.
stay. But you really never know. And most of the time when people give birth to one, they are itching to get another one. Like I want to give my baby a brother or a
Brother.
sister
Yeah.
and all of that. Yes. So they want to know. And at that point, like, okay, I wish I froze and all that. Yeah. So it's better than to say I wish. You better save it now and be thankful later you did. Okay, so yeah, another thing that might be in people's mind: how long can they freeze for? Do all embryos or all sperms or all eggs do they all survive freezing? Because that's you who
Yeah.
are the ones in charge.
So
Yeah.
all gametes can be frozen.
Okay.
Yes, sperm, eggs,
Oh.
embryo.
Okay.
So whichever one you want to freeze, all of them can be frozen, and it can be frozen as long as possible.
Oh. See.
Yes. So far, you give us the consent to continue the freezing. Of course, it will be frozen as long as we have outside that have been frozen for 5, 6 years.
Wow.
It's when the patients are ready, they come back to get this thing. Even the embryos, even those that are in the consent, they tell you, okay, if I have excess embryo discard, we still call them back. We notice in your consent, this is what we take, this is what you're having. Would you still confirm you want us to go ahead with this? Of course, when they confirm, you honor their wish. So embryos, sperm, eggs can be frozen as long as
As
possible.
possible.
As much as you want it frozen, of course, we keep it. When you're ready, you come back for it. When you're ready to use your sperm for treatment, you come back, you have it.
So it means that well, but it has to be in a good condition.
Of course, it has to be the quality. Before all these things are frozen, they will be analyzed, and then the chances of successes will be discussed with you. So,
Okay,
but if
so
it's good quality, of course, you expect that a good
they should
number of them they
survive.
should survive. Of course,
Okay, thank you. So well, I would ask, what do you think are the most challenging processes that you have to go through in your IVF lab? I mean, yes, I know this is your field. We might have one or two embryologists watching. Yeah, if you have any of them, you could also drop a comment and let's say hello to you. But I as much as you would have things that you enjoy, I'm sure there are a little challenges. And then I'm also wondering, some people have fears. How am I sure that it's my garment you are treating? How am I sure that
Yeah.
it's not someone else's garment that you're
So
giving me
if
and all
from
that?
the field, you should see that it's a field where precision,
Hmm.
top notch, no room for errors, no room for mistake,
No room, no
no
room.
room
You
for
said.
errors. Everything is properly labeled, everything is properly calibrated, and there is no room for errors because you're dealing with life or at cellular level. And any mistakes in this thing, of course, the repercussion can be very great. So the challenge, the will I say is a challenge? I think it's a place where mentally you have to be 100% every time,
Hmm.
focused every time, no distraction.
Hmm.
There's not a place where you just come and play or you come and joke or you come and no. The embryology lab is the heartbeat of IVF treatment where all the magic happens.
Hmm.
No play, no room. Everything has to be done and timed, of course. And
Hmm.
that's why you can't, when an embryologist is busy or in the process of doing treatment and everything, they don't respond to anything around them because
Time
you're
to
in this thing,
focus.
you're focused, you cannot make mistake. In
Hmm.
fact, you should not make mistakes. And that's why the double processing is there. You're working with your team. There's the
Hmm.
witnessing where as you do something, somebody is saying, somebody witness. I have three embryos here. I'm dropping three embryos here. You come see three embryos there.
Yes.
Confirm what this is the quality of embryos I'm getting. You
Confirm.
confirm because there is no room for mistakes or
Yeah.
errors.
Hmm.
So it can be very taxing mentally because that's what you do every day. But over time, you get used to it and it becomes a way of life and your way of doing things
Hmm.
because that is what you need to do at every time. So probably that, and then handling of these gametes may be challenging. The technical parts where you're always careful because temperature, there can be temperature sensitive.
Hmm.
Yes, the particular temperatures. Then how you handle them too. You use glass, some glassware, some plasticswares to handle these things. So
Hmm.
you have to be just careful. But that's just the interesting. Over time, you get used to it and it becomes norm for you. But you have to be 100% anytime you're working in the embryology lab. No room for distractions and no room for errors.
First of all, to begin with, so viewers, you with all this that Mr. Stephen has explained, you can see that that's why you cannot just go to anyhow kind of place and say,
Yes, of
okay,
course.
yes, a lot of centers do IVF, but I'm sure that all centers are not the same. The way they
Yes.
operate, they are not the same, and that's why if you must go for an IVF, you have to go you have to go to a place with very high standard where you know that
Where they are ISO
every
certified,
yes,
just
exactly, where
like
you
we are.
know. Yes. So where you know that high standard, what standard exactly? What standard is maintained? Yes, like you have at house hospitals. Make sure you go to a place where what standard is maintained. So you're sure that whatever is coming in is guaranteed. When they tell you it's A, it's A. When they say it's B, it's
Speak.
B. Because I know a lot of times you hear some very very sad stories and
Yeah.
all that, and it's really sad. That's why you should be able to be sure of where you're going to. I mean, get good reviews from
Yeah.
people too. Yes, as much as you're also finding, also make sure you also have some people with experiences. And then, yes, even though not all experiences could be genuine, some people could say things that are false about some places. So it means that even when they are telling you, you have to shine your eyes. Let
Yeah.
your both eyes be very much open. Well, in we have a question coming from Ladi. Literally, she has to have an IVF because she has blocked tubes. So she's saying that AMH, because of her age, they've told her chances of succeeding with her age is poor, and her husband is refusing donor eggs. I wonder why the man is refusing donor egg. I think maybe Ladi, your husband should have a talk with us at house hospitals.
Yeah.
Maybe, just maybe.
So
Well,
that
she's asking what she can do since her husband is refusing.
so
Uh,
I think
um,
she should come in. Let's have a talk. We would
mm,
like to discuss the options she has here. So we need to see the age. They are very, if the husband is refusing, one thing she can plan for is ovarian rejuvenation.
mhm.
That's another option for her where you will take her blood, process it to stem cells, and then we inject. But she needs to be assessed to know so that we'll know her condition and well-being. But ovarian rejuvenation is an option for
Option
her.
for her.
Yes, for her
Okay.
where This goes revitalizes the ovaries,
Says
and
she's
then better
41.
eggs. She's
Yeah.
41,
Mm.
and then better eggs can be produced. But she needs to come in to see us so that we can have a detailed
Mm.
explanation and provide options for her where she can access.
Okay, so hope that answers your question, Laddie, because he has preferred that. So we hope to speak with you more in details because yes, this is something that is really private and we'd
Yeah.
like to keep it confidential with you. So for confidentiality reasons, you could book an online consultation to begin with before we get to see you in person, and then we hope that somehow you're able to achieve your fertility dreams very
Of
soon,
course. Yeah.
sooner than you expect. So yeah, as we wrap up on this session, what's your counsel generally from your field as an embryologist? What's your counsel to people generally with respect to gametes, gametes? I mean, that's their egg or
Mm.
sperm, or the lab in general. Just what's your counsel to
I
them?
think what I would tell people, the fertility cases is on the increase, and there are a lot of quacks there out there practicing as the real thing. And
Hmm.
reproductive medicine is funny that somebody can still be doing rubbish and may be able to achieve results. That's
Hmm.
the mysterious part. So, but go to a quality facility where they're ISO certified, where they're expert in this field that handle all these processes. The internet is there. Go read on these processes. So
Hmm.
when you see these experts, if what they are telling you is not in line with some of these processes, the basic
Yes.
processes, because of course they are experts in the field, they will advise you on what. But know that when you're coming in for IVF, because some people tell you they're doing IVF, and then when you tell them to explain the processes, what they are saying is not IVF. So make sure you go to a certified clinic where the
Hmm.
experts are, because you're not just going there to have a child, you want to have a quality baby that is yours. So make sure you go to the place where the writing and ethics of this job, because
Yeah.
there are a lot of things out there. Ethically, the right thing is done, and you can assess your care in the most hospitable and professional way, which is what we are known for and what we do in Apps Hospital.
Yeah, so viewers, hope you've noted that you don't just go to any health center, especially if you're someone that feels like, okay, as much as IVF does not guarantee 100%, but if you feel like your fund is a challenge and you want to get it right, then you have to check for quality
Yeah,
before you
quality,
consider,
of course.
okay, yes, you might get a place for good quality and it might be expensive, but you know that your money is not wasting.
Yeah,
Even though it's not guaranteed that you go to that place,
and
it will
get.
still succeed or
And some are
not
lucky, they come in.
once and that's it exactly, so you just never know. So yeah, like you heard him saying ISO, but that's more like saying just go to a place that is practicing international organization world standard, like it
Yes.
has to be world standard kind of care, so you know that whatever it is they are doing, if you go to US tomorrow is standard,
We
if you
have
go to the
bodies
UK
regulating all
is
these things.
standard,
Yeah.
like whatever it is you're doing, whatever it is they are doing, wherever they are practicing is world standard of doing things, world standard of doing things. Well, that's his take home for you. So you're sure that you're getting quality of service. I know that a lot of people are battling with fertility issues, and yeah, you just keep wondering when is this going to come to an end. Yeah, it's not far fetched from you. It's not far anymore. As long as you're hearing this information right now, it means that you're already one step ahead and
Hmm.
you're one
Don't give
step
up.
close to achieving your fertility dreams. So do not be scared of taking a step. You could book an online consultation to start with, or you could come to any of our centers, either Alps Abuja or Alps Jos. Yeah, the address, you could get that on all our social media handles, on our website. You could get all of that, and you get a lot of information that would actually help you and draw you closer to your fertility dream. We hope that sooner than you think or you ever imagined, you would actually get the answers to your fertility prayers. And yeah, you're somehow holding your bundle of joy, your babies soon, soon, soon. Thank you so much, viewers, for staying tuned with us. Like I said, we're active on all our social media handles. Anyone you could mention or think, we're actively there. So please always watch out for our notifications, like, share, connect us to as many people as you can. I mean, you could share this to help people know that something good is happening here, and you just never know the prayer you might be answering unknowingly to you. Thank you for engaging us. Thank you, Mr. Stephen. It was good to have you. Until we come your way next time, have a lovely weekend. Bye.